So moving on, I want to introduce Leslie Stamper and Jennifer Dalton. They're going to talk about health insurance. Which one? I don't.
Does it say, there's one that says health and wellness? Yep. Okay.
Okay. Perfect.
Perfect.
All right, thanks for everybody for attending today. My name is Jennifer, and I'm the nurse manager at the WSU Health and Wellness Services. I gotta hold this in my hand. So my part of the presentation today, I just want to give you an idea what Health and Wellness Services is and what services we offer. And then Leslie, my coworker, will be up to talk to you more on the insurance piece of the presentation today. So this is just a shot of our building. Our building's located at 1125 Southeast Washington Street. And this is our contact information. hws.wsu.edu is the website. Lots of helpful information on the website, and I'll kind of go into that in a few minutes. And then the main phone number. So Health and Wellness Services is your full-service medical clinic. We offer a wide variety of services from same-day appointments to scheduled appointments. We have a full on-site pharmacy, so you come see the doctor, you need a prescription, we can get the prescription for you right in the same building. So kind of a one-stop shop, which makes it really nice. We have a 24-hour telephone nurse, so if it's the middle of the night, you're not feeling well, not sure what you should do, you can certainly give us a call, just calling that main number. And during after hours, you will be transferred to Harborview Medical Center and speak with a nurse there, and they can give you advice whether you need to go to the emergency room or give you some advice on what to try until we open the next morning. During business hours, you will speak to one of the nursing staff at Health and Wellness Services, and we will still provide that helpful information to you. We offer immunizations. We do have a laboratory and x-ray services in the building. They are contracted services, so they are not health and wellness services, but we do have those capabilities available. We offer allergy injections, so if anybody does allergy desensitization, you can come in with your allergy serum and your schedule, and we're happy to administer those injections for you. We offer traveler medicine, so if you were planning on studying abroad at any time during your program, you can come in and meet with our healthcare provider. It's Kelly Williams. She's our nurse practitioner, and she'll sit down with you and talk to you about what immunizations you may need, safety concerns for the area you're traveling to, provide prescriptions for any sort of antibiotics you may need, and really a really cool package for you guys. We also have a women's clinic, so full service women's clinic, any sort of women's health needs, annual exams, birth controls, any kind of things there you can be seen in the women's clinic. We have a nutritionist, and she does a nutrition clinic for us every Wednesday. So if you're interested in a healthy eating plan or wanting to eliminate something out of your diet, you can certainly come in and talk to her, and we can help facilitate that in a healthy way. And then we opened in March a vision clinic. So it's a new service to us, but a great service. Full service vision clinic doing eye exams, and I'll go into that here in just a few minutes. So just so you guys can get an idea, we see about 250 patients a day at the health clinic. And so in order to do that, we put together these next couple of slides to give you some faces to the names of our staff. All of our physicians are board certified family practice doctors. However, some of them have went on to specialize in other areas, and that will be indicated here in just a second. So here are some of the family general medical providers. So you can see their names there, and they all practice at Health and Wellness Services. As I mentioned, other specialty areas. So we do have 4 board certified sports medicine providers. As you can see there, Dr. Vu, Dr. Henry, Dr. Garcia, and Dr. Radakovich. So any sort of orthopedic strains, sprains, fractures, issues in that way, come on in. We can certainly help you out with any sort of things to get you better and back to participating in whatever athletic events or sports or whatever you want to be doing. We have an internal medicine doctor, Dr. Linda Fern. So Dr. Linda Fern specializes in internal medicine, obviously, but she is somebody that helps with a lot of our students who have chronic medical conditions. So if you have an ongoing chronic medical condition, we would recommend maybe establishing care with Dr. Fern. She has the ability to collaborate with your providers back at home or wherever you've previously been seen, and able to spend extra time in helping meet the needs for those who have chronic conditions. Pam Spence, next to her, is the nurse practitioner that staffs our women's clinic. We also have the behavioral health suite, as you can see, and that's some postdoctoral residents, a psychologist, and a psychiatric nurse practitioner are staffed there. And then vision clinic, we have Dr. Rachna Narula and Julie Keller, the nutritionist, as I mentioned earlier. So at Health and Wellness Services, we have an electronic health record. And some of the cool features for you guys to be aware of is that by going to the Health and Wellness website, using your MyWSU login and password, you can access our patient portal. And what that portal does is it allows you to schedule appointments 24 hours a day. So not feeling well, again, you can log on, schedule your appointment to be seen for your illness or your routine care. You can also request prescription refills from the pharmacy. And you can also communicate with healthcare providers. So if you've come in and seen a healthcare provider, that gives you access to have dialogue with them via the secure portal about any sort of conditions or things that you have discussed with them. So a lot of times our healthcare providers will discuss with you via the portal lab results. You came in, had a lab result drawn, they'll send you a message along with a snapshot of your actual results, so you can see them along with their dialogue, whether the results are normal or not normal, and what the follow-up care is going to look like. Appointment times, as I mentioned, we see over 250 students a day, so they are very hot commodities oftentimes. So we try to send and notify students as much as possible when you have an appointment scheduled. So you will receive an email notice from us at your WSU email address, and then 2 hours prior to the appointment, if you have signed up for text messaging, we will also send you a text message reminder to be seen. You can also cancel your appointments, and that's a key thing for us since July 1st. If you do not show up for your appointment, because we need those appointments to see sick people, there is a no-show fee, and it's $25. So if you don't show up, you get charged $25 for not showing up, because that's a missed appointment for somebody who needed to be seen but wasn't able to be seen. So just a brief introduction on immunizations. Washington State University requires the measles, mumps, rubella vaccine. So you need to have 2 documented doses of this vaccine, or we can also draw your blood and do a titer, and that's where we prove that you are immune to the measles. So that's what's required to attend. We highly encourage all vaccines, though, and administer all vaccines at the clinic. So other vaccines that we highly recommend and we encourage you to get if you haven't are the meningitis. There are 2 types of meningitis vaccine. The one is the MCV4, so that covers 4 strains, and then the newest one out is the meningitis B vaccine, and we offer both of those at the clinic. We do influenza outreaches every year, and we will be receiving our influenza vaccine hopefully within the next couple of days, at least this portion of the order that we placed. We often do hepatitis A and B and the tetanus boosters for you and the HPV vaccine. For folks studying abroad or part of the veterinary medicine program, we offer the polio, typhoid, yellow fever, and then the rabies vaccine. So you can get any of these vaccines at Health and Wellness Services. You can call us, schedule an appointment to come in and get it, or you can also walk in. So a lot of times we get questions, where do we go, what do we do if Health and Wellness Services is closed? Because we are not open on Sunday, and we do have just kind of an urgent care from 9 to 1 on Saturday. You can always call the 24-hour telephone nurse, and that's the phone number there for that. You can also go to some of the urgent cares in the community, and so we recommend Pullman Ready Care. That's part of the Pullman Regional Hospital. Pullman Regional Hospital also has their emergency room. And then Pullman Family Medicine often has some after hours when health and wellness is closed. Those are some recommendations for you. If you do not have a car, many people don't, the buses, sometimes the routes will stop out in front of the Pullman Regional Hospital. And then the other options we often utilize, even sometimes at the clinic, are the taxis. There's pretty good taxi service here in Pullman too, so you can always call a taxi and they can transport you over. Obviously, if it's an emergency, you would want to call 911, and that's when the Pullman Fire Department would respond with the ambulance and take you to the emergency room at Pullman Regional. So as far as the pharmacy, as I mentioned, full service pharmacy. So we have a stocking of over-the-counter medications. You can transfer your prescriptions. If you have any refills left at your pharmacy back at home, you can transfer those to our pharmacy. You can do that by calling our pharmacy, giving them your prescription number, and they will contact your pharmacy back at home and transfer those refills. You can also request the refills online, like I mentioned before. They do direct billing to the insurance providers, so make sure when you come in, you do have a copy of your insurance card, front and back. The little circle there is just an example for those folks who have Blue Cross Blue Shield. That's the prescription benefits. So you always want to make sure that you have a copy of your prescription benefits to give to the pharmacy so they can charge your insurance. And then, as I mentioned, the over-the-counter medications, a wide variety of vitamins, cough drops, Tylenol, ibuprofen, a little bit of everything in the pharmacy there. And then the full-service vision clinic. We do comprehensive eye exams, contact lens fittings. She is also able to do pre- and post-op LASIK care, and then any sort of treatments for eye conditions or injuries. So come on in, check us out. There is a large selection of frames in the pharmacy, many designer frames, many very inexpensive frames. And then they've put together a Cougar package. For just $200, you can get a selected frame, the single vision polycarbonate lens, and anti-reflective coating. And that meets most of the insurance. Most people have a benefit for that. So, and speaking of benefits, I'm going to transfer this on over to Leslie, and she's going to talk to you about all of your insurance and benefits.
Thank you, Jennifer. My name's Leslie, and I work in the Billing and Insurance Department at Health and Wellness Services. And I'm going to talk to you today about billing and insurance at Health and Wellness Service. I'm also going to talk to you about your medical and dental benefits provided for you from Washington State University as a benefit to your graduate assistant appointment. So at Health and Wellness, we will take and bill all insurance plans that have an address here in the United States. Billing a plan and getting paid by a plan are two different things, and so some plans don't have benefits unless you're in-network or contracted. I suggest checking with your insurance carrier to see if they have us listed as in-network doctors, and here's a list of the insurance plans that we are considered contracted or in-network doctors with. If you are new to Washington and you do not have medical insurance and you're establishing residency here in Washington, the Washington State Health Benefit Exchange will have insurance options for you for an optional purchase, as the university does not offer optional insurance. So if you did need to purchase insurance through the Washington State Health Benefit Exchange, you can go online to wahbexchange.org and complete an application. Moving from out of state does allow you the special enrollment period if you're uninsured. So if you have any questions with the enrollment process, you can come and see me in the Billing and Insurance Department at Health and Wellness, or give us a call at our main line, which is 509-335-3575. I'm just going to go over some of the main questions that we receive in the Billing and Insurance Department that might help so you don't have to give us a call. Again, we will bill all insurance plans, and so we ask that you bring your insurance card with you to any appointments that you have. A lot of families will have parents with dependents on their cards. They'll just take a picture of their card, and so you have the card on your phone to show us at any appointment time or any outside appointments. and any amount not covered by your insurance policy will be billed to your MyWSU account. And so that's important to remember that you're not going to receive a bill from us, and that's unique to health and wellness, and any outside provider would be sending you a bill in the mail for any patient responsibility. So again, you will not receive a bill in the mail from us. We will put any charges on your MyWSU account. However, any unpaid balances on your MyWSU account will result in a hold in your ability to register for classes and access your transcripts. So it's important to have those balances paid in a timely manner so that it doesn't impede your ability to sign up for your coursework. And if you're ever concerned about the cost of a service and insurance coverage for a service, you can check with us in the billing and insurance department, and we will attempt to do a benefit inquiry with your insurance plan to determine coverage rates for services rendered. And again, call our billing and insurance department with any questions. So at Health and Wellness, we offer a PASS program for our graduate assistants or graduate student population, and through this program it allows us to enroll your spouses or registered domestic partners in our access program so that your spouses and domestic partners are able to receive care at Health and Wellness. You will be required to complete the enrollment process each semester if this is something that you're interested in, and there is a fee associated. You can download the forms if this is something that you'd like to do at studentinsurance.wsu.edu, or give us a call at 335-5293 for any details. So now I'm going to talk to you guys a little bit about the Graduate Assistant Medical Insurance Plan. And for any students that don't have an assistantship but are international students holding an F or a J1 visa, the benefit information for this will be the same for the international student insurance policy. So this year the plan is provided by Ameriben, and this is new this year. We've previously had a different insurance carrier, and your plan starts today, August 16th. One of the great benefits of the plan is they have low deductibles. For the 2016-17 policy year, your deductible for medical services and medications at Health and Wellness will be $100. Medications and medical services provided by outside providers will be $500. You can use this insurance nationally and internationally, and the information on how to use that will be provided in your benefit information. The insurance plan also has their own unique 24-hour emergency care hotlines for all Ameriben members. So in regards to the enrollment information, again, coverage begins today, August 16th, and you will automatically be enrolled in both your health and dental insurance plans if your appointment affords you insurance benefits. On September 1st, the enrollment process will be complete, and you will be able to go online to the insurance company's website, again, it's Ameriben, and create an account to access your benefit information and your coverage documents, so your insurance ID cards. And so that should be to you by September 1st at the latest. We're hoping maybe a couple days previous to that. If you need to see a provider between now and September 1st and you're choosing to go outside of Health and Wellness, just contact us at student.insurance@wsu.edu, and we will get you some temporary coverage documents to provide to the outside doctors. If you have dependents that you were hoping enrolling in the insurance, you will need to complete a dependent enrollment form. That form is available at studentinsurance.wsu.edu. It's important to note that any enrollment or cancellations will need to be processed by the 13th day of classes. And for this semester, the 13th day of class is September 9th. And you must re-enroll your dependents each fall and spring semester. So you won't have continuous coverage in January, and you will need to complete the enrollment process again. And again, for any additional enrollment information, please call us at 335-3575 or email us at student.insurance@wsu.edu. Some of the plan information, the plan brochure and insurance cards will only be available online and on the app. So if you do come to Health and Wellness Services, we will not be able to provide that information to you. It will all be done through your account that you have with the insurance carrier. So you can download their app through the App Store and go online on September 1st to view your policy information. And again, please call us if you need to see a provider outside of Health and Wellness before this date. Some of the new benefits for fall of 2016 provided to you by your insurance carrier is Healthiest You, which is a 24-hour telehealth service that connects you with a board-certified physician via phone or video chat for a consultation. They can go as far as diagnosing and treating, so this is a great benefit for you if Health and Wellness Service might not be open, or it might be Sunday afternoon and you need some acute care. You can give this number a call and they will provide you with some telemedicine care. They also have the Student Assistance Program, and this is a set of services including the 24/7 counseling. They can provide you assistance with legal and financial issues, as well as mediation services. Another benefit of the policy is you're provided global emergency services. So if you're traveling outside of the US or 100 miles or more from your permanent residence, you will be provided with benefits that give you access information to doctors, hospitals, and pharmacies, as well as certain other services when faced with a travel or medical emergency. So they can help you if you lose your travel documents and if you need direction on if you're having legal issues, etc. So all of those services are included in the benefits afforded to you by the graduate school. And for more information about these benefits, please visit our website, which is studentinsurance.wsu.edu/graduate assistance. The Graduate Assistant Dental Plan is administered by Delta Dental of Washington. They have preventive/diagnostic services will be covered at 80%, and basic services such as restoration will be covered at 60%. Plan information is available on our website at studentinsurance.wsu.edu or by calling Delta Dental directly at 1-800-408-9850. So here is all of the contact information for our different departments. For the main clinic line is the 509-335-3575. As you can see, there's a unique line for the pharmacy as well as the vision clinic, billing and insurance, and our programs and outreach. However, if you call the main line, you will be routed to a phone tree that will give you the option of reaching out to each of these individual departments. And that's all I have for you guys today. Thank you very much.